Hello everybody, this is Edgar Eddie Fernandez, the founder of Sufficient Limited and the creator of the Experiential Knowledge Solution program that helps you to understand and optimize the ideas of your workers and employees to stop people get injured, reduce cost, and increase performance and production. Well, after this intro, something that I want to talk to you about it. I published on Monday in LinkedIn and a report uh, from the GMPs that was published from the Chemical Engineering magazine site, and I published that. It's in PDF, 30 pages long document, very well detailed, explaining what the violations are. They call it the top cGMP cited violations on the fiscal year of 2019. I won't mention the valuation. I won't mention only one or two, for example, because it's very long report and very detailed. It's better that you read it with your own eyes, and you have your own conclusions what is going on. And actually, I put 3 or 4 recommendations that you can look at it to avoid those forms 483. So be on the list of the top 10 cGMP cited violations. Actually, they don't mention any companies. They mention industries, and actually, the number one is food industry. The number two is the medical device industry, and the number three, they call it drugs, but it's the pharmaceutical industry. So those three industries are the top. The three that they are getting these top 10 cGMP cited violations and reviewed. And actually, one of them, I have the report in front of me. I want to mention three of those. Is a procedure not in writing, fully followed. So scientifically sound laboratory controls. Apparently, the controls are not established, or they are not scientifically sounded. An investigation of discrepancies failures as well. I'm gonna mention on that. Something that caught my attention, and it's not related with cGMPs or how you should do your you establish or tackle these type of problems in terms of from the quality assurance standpoint of view. So you see the failures. The first one, that is the procedures not procedures. Let me see here. Is procedures not in writing, fully followed. So actually, they say that the responsibilities and procedures applicable to the quality control unit are not in writing or fully followed specifically. And you see the failures here. One is that your procedure says that in order to approve a batch, right, you need to manufacture or produce 3 validation batches. And they said that during so many inspections or audits, they said that they have found that only 2 batches have been validated. There is not the third one, doesn't exist pretty much. And there is one is failed, and there is not investigation about those failures. Actually, there are other, like for example, for electronic controls or manual controls of temperature, for example, they say that the temperature charge in 5 batches, but the batch was during 5 days, and the temperature sensor was failing during those 5 days, and nobody investigated that. So, what, in my opinion, in my experience, maybe you disagree or not, but I want to put it on the table for discussion with you. Exactly what is the problem of having these top 10 cGMP violations? The question number one that can come up to your mind is, or my mind is, really our quality assurance department or quality assurance system is working, is covering all the aspects of our operations and is in compliance with the FDA regulations? The second one is our teams or people who are in charge of these departments. They have the right knowledge to fulfill the positions? All these questions that come out to your mind. My answer, or my opinion on that, I think, is not those questions that we need to answer. I think it's about culture, company culture. Because if somebody's failing, or a department or an entity, I don't know, is failing to investigate or identify even that is a failure of the temperature and the temperature sensor for 5 days during the batch production, I think it's company culture. And in company culture, I'm not telling you that your company is so bad. No. It's now we are so overwhelmed that the company culture is on a disruption right now. So your company and the way you do things and your people are so disrupted by emails, by cell phones, by Facebooks, Instagram, checking this, checking that, problems outside, anxiety, depression, all that stuff. Really, really, that there is a problem. And actually, I was reading an article from McKinsey. Now, let me see it. I have it here. And then I'm going to write an article of this one. But it's something that caught my attention is the problem is not the FDA violations. The problem is our relationship with the problem. Our relationship as a company and as individuals with the requirements with the FDA. I imagine sometimes they are so overwhelming that they overwhelm the organizations. But why, when it's a failure or something, and we need, the FDA requires us to investigate. In my experience, we come up with always with a new controls, new procedure, new this, new inspection sheet, something new, or we modify procedures, making our systems much more complicated. So, what is the way to solve this problem? The answer, I don't have it, to be honest with you, because it's for the thing that I agree, and reading this article and reading the report is something about the culture of the company. And it's not saying the company is so bad or these companies are bad. No, no. It's how now, as a company, you're going to reinvent yourself, taking in count these issues that you have in outside, coming from outside to the inside of your company, and that are affecting you. Problems with like mental health is one. Um, Cell phones and tablets. I mean, keeping people distracted, because that is not keeping people busy. Is you are so distracted that you lose a lot of time. It's 5 6 hours. There is studies that people are losing only watching and scrolling the cell phones. Obviously, that is affecting your performance in your job or in your business as well. But as organization, I think we need to find a way to lead different. So actually, linking this report with the article from McKinsey and Company, leading with the inner agility, I found 5 excellent points that they mention on this article that I want to touch with you, because really, really, they are very important to avoid these non-conformance reports or forms from 483s from the FDA. So pause to move faster. That you see at the beginning, I started like we always trying to create more procedures, more controls. Or we fail this, boom, another procedure, another step on the procedure. But really, we are not going through the real root cause of the problem. That is the reason why the relationship with the problem is very important. The problem is not the problem. It's the relationship that you have with that problem, according to this article, and makes perfect sense about it. Why am I going to add another step? Okay, so So pause to move faster. What we need to do, what's going to be the new strategy? I have the right strategy. What I have currently in place that is working or is not working. What is making so complicated this process? So you can like following the five S's. You can clean what ID. You can clean the procedures, documents, and steps or controls that they are not really helping you a lot. It's causing you more troubles. Number two, embrace your ignorance. As the article says, I'm not telling you. I don't want to offend you, but that's a really another good point. We don't know everything, and in all my experience, I'm seeing the only few people, especially on the top, they make the decisions regarding on FDA. And absolutely, they are the guys that need to make decisions. Don't get me wrong. That's they get the paycheck, and they have the knowledge and they have the skills to fulfill that position. But when we start implementing procedures, another procedure on top another one, on top another one, um, so the QA department or the validation department or the process engineering department, they have approached people on the floor. They have we have asked or have we asked people on the floor what type of issues they have, what are the reasons. I mean, why are the reasons that they don't fulfill, they don't follow their procedures, or they have a lot of manual corrections on the batch records, for example, on why you only manufacture two of instead of three batches, and what happened with the third, and why you don't analyze the problems on the second one, according to the FDA report. So the article actually here, when we embrace our ignorance, is that we need to approach people on the floor and then collect all the information to give that to your steering committee, directors, vice presidents, managers, and then they have all the information on the front, and they can make those very well informed decisions. That's the word that I want to use. Very well informed decisions. So at the end, maybe they know the problems, or there is something there that is bothering them, and they are not following those procedures. So that's the relationship with the problem. Um, and then discover another ways to implement ideas and these processes. Radically reframe the questions. So instead of saying what is not working or why are not following this procedure, it's can you tell me what roadblocks you have to follow this procedure? And then you start these conversations, that's going to happen, and you're going to find the answers. That's a simple one. Second one, and actually I found it very interesting in one of the I saw it this one time actually. The temperature, the room control for one of the facilities was 60 meters or 70 meters away from the manufacturing site. So actually, they cannot see the controls from the manufacturing site to the computer, right? So obviously, you're going to have violations. You're going to have no conformances. So that's the thing that you need to see. It really your the setup of your workplace is the right one, because maybe you're gonna find that you're gonna find surprises. Set direction, not destinations. Um, it says here, yeah, I totally agree. So instead of telling them what they need to do, because that's happening nowadays, make teams to solve that issue. Let them to lead the change. Managers and VPs and directors, they don't need to do everything. In fact, they don't need to make all the decisions, to be honest with you, because they are in one meeting, in another one, another issue, another decision, blah. You have multiple tasks that you need to fulfill in your position. Let the others that are facing that problem lead the change. So set the direction, not the destination. And in FDA, especially in QA, we are setting the destinations. That's the reason why we pile and pile procedures. And the last one, obviously, test your solutions. It worked, yes. If not, move on and test another one. Sometimes, and many times, we don't want to test new ways because we are not really willing to absorb the failure. We don't want to fail. We don't like to fail. But believe me, we are failing because the report is very concise. And then actually you can find on the FDA side, this is not new. This is coming from 10 years ago. It's the same type of violations. Many times, many times, FDA has been encountered these many years in a row. But us as a company, what we do, so we are failing. So test new solutions, fail inside, and then move on to another one. And then if that's the right solution, now move on, implement it, and then now you want to avoid Forms 483 that they're gonna impact actually your market, your supply chain, and everything to supply your market in the United States. That's the thing that I link the article and the report. It's in summary is the relationship with the problem. So summarizing these 5 steps that this article says, and actually is a pause to move faster. So actually rethink what you need to do, test new ideas, new ways to do things, embrace your ignorance. You don't know everything. Don't pretend to know everything, because that could be a problem actually. Radically reframe the question. So now go to the floor and start asking questions, right? Set the direction, not the destination. And that's a new paradigm, because really on quality management systems, the things that we do is we set destinations. I'm not telling you not having a quality management system or a safety management system or an environmental management system. At the end, those systems, they give you a frame on how or what you need to do in regarding on compliance. However, make your system flexible. So don't be so rich, so stiff to not to move and change faster. So that's the step really wants to tell you. And the last one, tested solutions. There is no other way to do it. Hopefully this video helps you to help this to fix this problem. That's my input, and that's the things that I'm seeing through my experience on 20 years on the pharmaceutical and chemical industry and manufacturing as well. And always we go to the destination. We don't go with the system, with the direction. We are not so flexible. So that's the reason why it's so important to optimize and understand the ideas, skills, and experiences of your workers and employees, because they're gonna help you to tackle these type of problems. You're gonna be more flexible. You're gonna be so innovative. You're gonna find your know-how, and that know-how and that innovation fits your company, and it's perfect to move on and to adapt to the market and be in compliance. Thank you very much. Have an excellent day. Your friend Eddie Fernandez, the founder of Sufficient Limited, the creator of the Experiential Knowledge Solution. If you have any topic that you want me to talk, any aspect of the market that you want me to investigate and talk about it, or write an article, feel free to contact me on the description of the video on my social platforms, LinkedIn, Twitter, Facebook. Thank you very much. Have an excellent day. Bye.